Welcome to BERT'S TV channel. In this video we are talking about 8 ways to maintain healthy skin with type 2 diabetes. Skin problems are often the first visible signs of diabetes according to the American Diabetes Association. Type 2 diabetes can make existing skin problems worse and also cause new ones. Type 2 diabetes is a chronic metabolic condition that affects how your body utilizes glucose sugar. This happens when the body either does not respond normally to insulin or does not produce enough insulin to maintain a normal blood sugar level. While it's most common in adults, some children and adolescents can have type 2 diabetes. Risk factors for the condition include being overweight, having a family history of diabetes, having a history of gestational diabetes, and inactivity. While there's no cure, some people can manage their type 2 diabetes by eating well and exercising. Monitoring your blood sugar is also important. Sometimes maintaining a healthy weight is not enough to manage this condition. In those cases, a doctor will determine that medication intervention is needed. Insulin injections, oral drugs, and non-insulin injectables are some common treatments for diabetes. Causes of diabetes-related skin problems. Long-term type 2 diabetes with hyperglycemia or high blood glucose tends to be associated with poor circulation, which reduces blood flow to the skin. It can also cause damage to blood vessels and nerves. The ability of the white blood cells to fight off infections is also decreased in the face of elevated blood sugar. Decreased blood circulation can lead to changes in the skin's collagen. This changes the skin's texture, appearance, and ability to heal. Damage to the skin cells can even interfere with your ability to sweat. It can also increase your sensitivity to temperature and pressure. Diabetic neuropathy can cause decreased sensation. This makes skin more prone to wounds that may not be felt and therefore come to your attention at a later stage. How diabetes affects skin. Diabetes can have an impact on the health of skin in multiple ways. High blood glucose levels, hyperglycemia, are behind most of the skin problems caused by diabetes. Too much sugar in the blood prompts the body to pull fluid from cells in order to produce enough urine to remove the sugar, which in turn makes skin dry. Red and irritated skin also can result from damage to nerves. Diabetic neuropathy, particularly nerves in the legs and feet. Damaged nerves may not get the message to perspire, and perspiration helps to keep skin moist and soft. In turn, when skin is overly dry, it can crack, peel, and become itchy. Scratching it can create small openings in the skin. These openings provide easy access for infectious organisms to get under the skin, where excess sugar in the blood provides a fertile breeding ground for them to proliferate. Number 1. Opt for gentle cleansers. Harsh soaps can dry and bother sensitive skin. Mild shampoos or soaps are preferred, as they do not irritate the skin, Dr. Leey says. Avoid products that contain alcohol and opt for those that are unscented, suggests the American Academy of Dermatology. Choose skin care products that do not contain alpha hydroxy acid or retinoids, because these ingredients can be too harsh on the skin if you have type 2 diabetes. Gentle cleansers can also help prevent your skin's natural oils, which keep your skin hydrated, from being stripped away. Number 2. Moisturize daily. Keeping your skin hydrated helps prevent itching and thickening of the skin, says Leey. An important part of type 2 diabetes skin care is to prevent cracks and ulcers in the skin, especially if you have neuropathy. Cracks allow bacteria and other germs to sneak in and lead to an infection, Dr. Silver explains. Use a rich, thick moisturizing cream or ointment and slather it on as soon as you get out of the bath or shower. Also, be sure to moisturize more frequently in cold weather to prevent your skin from drying out. Skip lotion between the toes, though, as it can lead to a fungal infection, Leey warns. Number 3. Do not scratch, soothe. Dry skin can be itchy, but resist the urge to scratch. Scratching too hard can break the skin and increase the risk of infection, according to the ADA. Instead, take steps to soothe the itch by promoting moisturized skin, such as bathing or showering in lukewarm water instead of hot, which can dry out your skin and cause it to itch. In the cold winter months, try taking fewer baths and running a humidifier in your home to keep the air and your skin moist. Number 4. Prevent sweaty skin. Areas where the skin folds and gets warm and moist, such as the armpits, under the breasts, and the groin, are prime locations for infection. Candida albicans is the most common cause of fungal infection in people with diabetes, Silver says. It can cause itchy red patches to form according to the Cleveland Clinic. Candida grows well in warm, moist areas such as skin folds, which are frequently present in obese patients, Silver notes. Take care to keep these vulnerable areas dry and help prevent fungal growth. Number 5. Check your skin every day. Loss of sensation, especially in the feet, is common in people with diabetes, says Joshua Zeichner, dermatologist and director of cosmetic and clinical research at Mount Sinai Hospital in New York City. You may not feel an injury, which means you can miss the window to prevent infection. Inspect your skin each day to look for problems. Pay particular attention to your feet because missing a skin injury can lead to serious complications, including amputations, particularly in people with neuropathy, nerve damage, and those with poor circulation, Leey adds. Number 6. Treat injuries ASAP. A simple cut is not so simple when you have type 2 diabetes, so be sure to promptly treat any injury no matter how small. First, carefully clean the wound with water and a gentle cleanser, Leey advises. Then apply over-the-counter bacitracin ointment and cover it with a bandage to promote healing and prevent infection. If the cut is not healing or becomes warm, red, or tender, visit your dermatologist, he adds. An open cut, especially on the feet, can increase your risk of a deeper infection called cellulitis. Number 7. Control your blood sugar. The best tip for healthy skin and reducing the risk for other diabetes complications is good diabetes management with strict blood sugar control through diet, exercise, and medication. Good blood sugar control allows for the body's own defense mechanisms to work more effectively in clearing infections, Silver says. Keeping glucose levels well controlled will have the greatest impact on the skin, Leey adds. Long term, it also helps prevent neuropathy, dry skin, and poor circulation. Number 8. See your doctor. Skin issues are nothing to mess with. If you spot something unusual on your skin or note any signs of infection, head to your dermatologist or your primary care physician for help, Leey suggests. There are rare rashes and infections that occur in diabetic patients, Zeichner says, so make sure to visit your dermatologist to make sure you get any new rash or spot evaluated promptly. I hope you guys liked the video, and for more stuff like this, please subscribe to my channel and hit the bell icon for notifications. See you soon. Goodbye.